So the interesting thing is that inside your brain, you have a center called the vomit center.
Literally the vomit center.
Literally the vomit center.
Mm.
And
Creative.
this center responds to various stimuli. So a stimulus is something that will trigger that vomit center. Examples of things that could trigger would be certain chemicals, like chemotherapy. It can be smells, sights, memories, anxiety, pain. Nausea and vomiting is a horrible side effect to many of the cancer treatments. But interestingly enough, it's not just cancer treatment that causes nausea and vomiting. Something as unexpected as anxiety and fear and pain, all of those things can contribute to your feeling of nausea and your experience of the nausea.
Would it be fair to assume that nausea and vomiting is one of the more common side effects of cancer treatments, and your journey through cancer?
You know, it's such a personal thing because not all treatments cause nausea. Nausea, as you know, is that queasy feeling in your stomach, that feeling of being unsettled. Sometimes you almost have that long, greasy feeling at the back of your throat.
Like your throat is sweating.
Like your throat is sweating. I love that, yes. Whereas vomiting is actually throwing up. It's the expulsion of contents within your stomach. You can also retch, and retching is where there's absolutely nothing inside your stomach and you're just dry heaving. It's really uncomfortable and nobody likes it. It's extremely unpleasant. The problem is that we watch movies on TV, and on TV we see that here is a person receiving chemotherapy or radiation therapy or even surgery as the third treatment option for cancer, and you see these images of this person hugging a toilet bowl. It's not always like that, and it's certainly we don't want it to be like that at all. So yes, with radiation therapy, for example, if the radiation is being beamed to the tummy area, to the abdomen, especially the upper abdomen or the pelvis, that can cause nausea and vomiting. With surgery, again, the anesthetic drug, those chemicals can cause you to feel nauseous. Pain can cause you to feel nauseous. Any surgery to the abdomen can cause you to feel nauseous and even vomit. And then we know the chemotherapies, certain of them do not cause nausea and vomiting. And how strange it is that even though you know these drugs don't cause nausea, the patient still experiences it because they're frightened, because they're anxious, because they have a memory of a previous experience. There's something called anticipatory nausea. You're anticipating, you're expecting to become nauseous because that's all what TV has told you. That's what you've seen in the movies. So you anticipate being nauseous even though you shouldn't.
So a big mental component.
Massive mental component to being nauseous and actually vomiting. I did want to tell you an interesting story about recently. I had a young strapping man who came and visited me in the ward, and I had been one of his nurses through his previous treatment where we had given him chemotherapy. And this young man came to the unit strong, healthy, well, and as he got to the unit doors, some of those smells and sights and sounds triggered that vomit center, and he became incredibly nauseous and vomited, actually, after all those years of not being on treatment. So memory is a massive, massive role player in your experience of nausea and vomiting.
That's that emotional response that you were talking about earlier. He hadn't had anything done to him yet.
Nothing wrong with him at all. It's just the memory of coming back to the unit. Because we don't want a person to feel nauseous, we don't want them to be uncomfortable, the doctors are really good with prescribing medications, they're called antiemetics, to stop the nausea from happening. And those medications work really well in terms of the vomit center responding to those chemicals. But what about areas where the patient is nauseous because of an emotional aspect, because they're frightened, because they're anxious? Some of the medicines that can be prescribed certainly can help for that as well, but there are other techniques that you can use to limit the amount of nausea and vomiting that you may experience. But I think it's fair to say that you could confidently walk into a cancer treatment program hoping not to feel any side effect at all because they are well managed. And that's what we're trying to get to. We want the symptoms to be well managed. either by the doctor and the healthcare professional team, but also there's a number of things that you can do, self-help remedies, that can certainly make your experience a lot more pleasant and limit how you experience those side effects.
What are some of the self-help remedies that you have experienced in your career which kind of have worked best for a lot of the patients that you deal with?
Watching your diet. That feeling of nausea, I really don't want to eat anything. And it's probably a good idea to just be aware of what you eat before going into a cancer treatment session.
So maybe slightly smaller, less rich.
Smaller meals, often bland meals that are a little boring, that don't have strong flavors. Very often people say, try and avoid coffee. Now, I love my cup of coffee in the morning, but try and avoid a cup of coffee because it's quite a strong flavor, and that might trigger something.
I'm only 50-50 if that would be worth it.
Haven't convinced me. But bland meals, small sips.
Apple slices?
Apple slices.
Toast.
Sucking on ice chips might help. Sometimes our patients, I notice, have a little collection of lemon-flavored hard-boiled sweets or ginger-flavored sweets, and just sucking on that little sweetie can alleviate the nausea and stop it from happening. Deep breathing. Just being in that moment and taking a deep breath in and a slow breath out, releasing some of that fear and anxiety. Something as simple as that really works. Taking a friend along to the treatment with you and being distracted by chatter and banter and laughter. Keeping your mind occupied with another activity, a Sudoku, a crossword, read a book, keeps your mind off the anxious moments that you're experiencing in that moment.
I'm experiencing nausea. Actually, it might even not be in the treatment, as you have suggested. It might be when I'm at home. How long does that last for? What can my expectation be?
Nausea and vomiting usually resolve themselves after 2 or 3 days. And of course, at this point, if that nausea and vomiting should continue, it's really important to go back to your doctor again and tell the doctor or the healthcare professional that this is an unresolved issue and it's really getting worse, it's not getting better.
When do you escalate it? What if I am maybe too afraid to go back to my doctor so short after my treatment? When do I escalate it to try and get someone to help me bring it back under control?
I like to advise my patients to keep a diary. So to keep a diary of the moments of nausea, to try and link them to a certain time of the day, or perhaps relate them to certain foods that I've just eaten. Perhaps I'm actually vomiting, so how many times I vomited in the day, and when I vomited, and for how long I vomited. So it's really important to be aware that if the nausea and vomiting is increasing, not decreasing, if it's lasting for a couple of days and now it's starting to affect my nutrition, my ability to eat, I need to escalate it to a doctor because dehydration is a danger. We don't want anyone to dehydrate. We don't want anyone to go backwards in terms of their nutritional status. We want to try and keep ahead of these things. And apart from anything else, it's just really rotten to feel nauseous all the time. You feel weak, you feel really demotivated, you don't feel good about yourself. And so we certainly don't want that to go on for any length of time whatsoever.
So as a general rule of thumb, you don't need to try and fight this out by yourself. Escalate it early, get it under control because it's a manageable symptom.
If you're experiencing any side effects that you are not coping with, please go back to your doctor and ask for help. You don't have to suffer alone. Thanks for tuning in and watching our video. If you have any questions, comments, or even suggestions on what you'd like to see in future content, please leave them in the comment section below, and we'll get back to you as soon as we can. We're here to support you in your journey to learn more about cancer and how to manage it. Join our community and empower yourself with knowledge and resources to make informed decisions about your health.